under local anesthesia, so we numbed them up, and I really bombarded these glands, went down all the way down over here. Stealth incisions, no incisions over here or in the middle. That's an old incision from his gallbladder operation right there. So, microwear, it vibrates, Mercedes, long, 4 millimeters. And let's rock and roll. Are we on suction? Always protect the skin. Good.
16, 17.
Yeah, that's good. So let's go ahead and suck a duck. He's not a duck. All right, Lipo we call this. And look at the fat coming out. Look at, you all right? Good. A little bit. All right. Yeah. But look at what we're getting at. Hey, you'll look a little later. You'll look a little later. Oh yeah. This looks like the best fat of the day. Best fat of the day.
How long does the surgery usually take?
Oh, we started at 7:30. We're gonna be done like at 2. I take my time, man. I don't rush. It's all about results, results, results.
The surgery itself takes about, if it's 7 to 2 or 8 to 2, it's about 5 hours.
Yeah.
The recovery takes about 40.
Yeah.
You have to see doc 48 hours.
You tell them, Ben. You tell them.
Yeah.
You talk to them, Ben. You tell them, Ben. I'll buy you a hamburger later. You okay?
Daz, that's all dependent, The famous analogy is...
The famous analogy.
The famous analogy is if you ask me to paint your house and you ask me to paint one room, the cost is going to be much less than asking me to paint 2 rooms or 3 rooms. So if you want just the gland out, then that's going to cost, a certain price. And if you want Vaser...
Or you can watch the Borat movie. There's a famous line in Borat. It's an old movie about 10 years ago where Borat says, "How much? How much?"
It's about to fall. I don't wanna...
You right?
Yeah, no, it's about to fall.
Oh, sorry about that. Yeah. It ain't cheap, my friends. It ain't cheap. You get the Lebo.
If you want, you could always schedule a video consultation with Dr. Lebowitz, and he can take a look if you're serious about it.
Yeah. All right, so now we're attacking the gland. Get that mama out of there. Get that meatball. That Italian meatball. Guy's named Tony. Guy's named Tony, so it's Italian meatball. If his name was Sven, it would be if his name was Sven, it would be a Swedish meatball. Sven. Right? Maybe he's from Denmark, so it's a Swedish meatball.
Definitely the best fat of the day.
Oh yeah.
About $200.
Yeah, I'm going for a liter.
All right.
I mean, including.
Oh yeah.
You alright, babe? Good.
It's always recommended to lose weight before getting glands removed.
Yeah.
It makes it easier for the doctor, and it's cleaner.
For you.
It's healthier. Yeah.
Yeah.
It's better for the patient.
You okay now?
Yeah.
Good. Oh yeah. Oh yeah. We're getting some pasta fazool. Some pasta fazool out of here. Look at that fat. Look at that fat. Look at that fat over there. Oh yeah. Should we spuge soon? Soon? Then we got it all filled up.
Whenever you are.
No, we got some more. It's got to drip.
Oh.
There's a technique of spooging.
Dasby says he spoke to a surgeon and they said they would leave a lollipop scar under the nipple.
What the fuck is that? Lollipop scar. On a male?
On a male.
There's a Saturday Night Live. There's a thing about that called "What's Up with That." What's up with that? It's DAT. Should we go for it?
Do it.
Are you ready? Should we count?
3, 2, 1.
Oh, that was a mini one.
Nice. How you doing, my friend? Good.
Remove the nipple. Aye.
Run!
Aye.
Run!
That's what the doctor said, or they're telling you?
The viewer said remove the nipple. They said they would have to do.
Well, that's if you're really big.
And then just like put it back on.
Yeah. Just an ornament. You can hang it from your Christmas tree. What?
So what do you call that? Pasties?
The pasties? Yeah. You can hang it
Pasties.
from your Christmas tree.
You know what we call them chicken cutlets. The pasties.
Is there a Christmas tree in the Harmon house?
No, we don't have a picture.
You don't do it? You
How you
do it?
doing, my friend?
You got a little Hanukkah bush? You don't have little,
Elf on the
little,
what is it?
little stockings by the fireplace? You alright?
Yes.
Your arm? Which arm?
That's
Oh, put that arm down. Put that arm down.
Yeah.
I'm cool with that.
I got you.
The first night's rough, but after that,
Yeah.
you feel good. You just had an operation, so you're gonna be sore. The first 24 hours is usually it's pretty tough. New York Knicks asks, does the fat that gets filled in the chest go away with exercise and diet?
Nope. New York Knicks. What's better? Should he be called the New York Knicks or the New York Nets?
Well, it's the Brooklyn Nets.
Oh.
It's the Brooklyn Nets.
Oh, so it's the New York Knicks.
The New York Knicks, yeah.
Who's good there anymore?
Say it one more time?
Who's good there anymore?
Brooklyn?
No. Is it the Nets or the Knicks? This guy.
The Knicks.
Okay, so who's good at the New York Knicks anymore? Who's there?
Mitchell Robinson's really good. I'm a huge Knicks fan, so Mitchell Robinson, R.J. Barrett. I mean, no one that's like amazing, but we got some young pieces.
Then to answer your question, it's like stem cells. It stays. I mean, a little bit goes away.
So it turns into muscle?
Turns into muscle.
Correct.
Yes, New York Knicks. Change your name. Brooklyn Nets. Their jerseys are cooler anyway. Are they?
They're good. They're nice.
Which one? The Nets?
Brooklyn. Yeah.
Yeah, the jerseys are cool.
Dennis, you want to see what he's getting removed? He's getting this removed.
No, you're speaking to a dentist. Is that dentist the menace?
No, Dennis asks, what is this guy getting removed?
Excellent. How you doing, my man? Little stomach breathing, okay?
After the lipo, Dr. Lebowitz is going to take the glands out.
Yeah.
That's after, so.
Doing okay?
Yeah. Some nice fat.
Which one you got?
Am I getting some nice fat out of him?
Absolutely.
Look at that fat.
Tubing's full.
Getting some loving out of him. Some hunka burning love. Hunka burning love.
Some lip over there. You comfortable, my good man? Excellent.
You okay? Cool beans.
Dennis is from Guyana. Where's Guyana?
Guyana.
I don't know where that is. Where is that?
Guyanese. That's the Caribbean. I don't think it's Guyana. Guyana. I don't know. One's in the Caribbean. One's in Africa. But they say it differently.
Guyanese, exactly.
Guyanese.
Guyana is above Brazil.
Above Brazil. Okay.
I got a good friend in Rio. You can go to. All right, lift up here, my man. Give me a little blue towel for this one. We're gonna get this one. I got that one. I got it. Save those towels. Yeah, save those towels. I mean, you know, we got some other ones.
Yeah, I have. I sterilized some.
Was that?
I sterilized.
Yeah, we're over there. 850? Good. You alright, man?
Mm-hmm.
Uh-huh.
Yeah, good.
Uh-huh.
You're doing great.
That's up here. You alright?
Yeah.
Good. Oh, I just booked a guy last name Green.
No line.
No lion.
My twin.
Oh, I wouldn't shit you. But no E at the end.
Okay. Nice.
All right, so here we go. Let's get some of the back fat. You all right? Look at Levo. Look at Levo go. Who's on live? Guys, name some of my competitors. Who's my competitors, my audience? Name some of my competitors. I'm not going to name them. You guys can. You alright?
Yeah, good.
Alright, where are we at? We're at 1,000? You okay, babe? Under pressure, putting down on me, sitting down on me. I'm gonna get like 1,500 actually. go for 15. And then we'll, if he can't. If we get too much fat, we'll just switch this over to that and use one of those. You alright? What's that? Yeah, but not bad.
No.
Good, cool. Still a lot of stuff I want to get out of you. Still a lot of fat. What happened to my towel? The wet one. You want bye-bye? Yeah, give me that one. Yeah.
He doesn't want to cheat you, you know?
Yeah, he's there. He's there. You all right? Okay? You all right over here? Uh-huh. Uh-huh.
So sensitive.
Uh-huh. What's the difference between Marjan and Canasta? Anybody know? You don't know Marjan?
Marjan's with tiles. And
Marjan's with
Canastas,
tiles.
I think, with like chips.
Is it with chips?
Something like that.
Marjan.
That's an old Jewish,
It's an old.
old woman's game. I actually found one in a garage and I made $55 on it.
On it.
I sold it. I put it on Marketplace and someone came running.
Dennis asked, what is local anesthesia?
Local anesthesia. I mean, it's just, it's not general. You're not asleep. See, he's awake. Thumbs up. Wiggle your toes. Bend your knees. Bend your knees. See that? Bend your other knee. There you go. See, that's local.
Like Novocaine in the dentist.
Dennis the Menace?
Like Novocaine when you go to the dentist, that's correct.
Yes, Dennis the Menace. Are you Dennis the Menace? What do we got? A couple hundred more?
Yep.
Oh yeah. What's up here, my friendy? You okay?
Yeah.
over there?
You know what I want to do? Switch them, turn them on the side a little bit here. So let's get rid of this so we don't fall these. Okay, turn on your side, so your left side down.
Left side.
Turn that way.
Yeah.
Yeah, so he's
Try
gonna
to
go
get some on your
behind.
side here, my man.
Just turn on your side.
Yeah.
Good.
Good. Give me this arm.
Switch that
Good.
out.
I'm gonna just cover your face a little bit, all right? You just give me this arm. I got that.
Okay.
I want it wet. All right, you all right? All right, so he's a little bit on this side. Okay, Dennis the Menace, this is the beauty of doing it under local. I have him move. So that's his lax here. I'm going to turn him into a dachshund. Will be long and lean. So this is the Dennis the Menace. This is the beauty of local, Mr. Dennis the Menace. Is it just Dennis or Dennis the Menace? What?
Last name starts with an M, so could be Dennis Menace.
Could be Dennis the Menace. Dennis, you don't mind me making fun of you, do I? Hope you don't. You okay?
Yeah.
Good.
He says it's cool. He could take it.
You can take it, Dennis?
He could take it.
All right. There ain't nothing there.
No.
$100 more, my man. You all right?
Yeah.
Is that a moan of pleasure? What? Is that a moan of pleasure? You gotta love Lebo. Or you gotta hate Lebo.
Hopefully one day, Dennis.
Okay. Almost there. Yeah, you can put on back snake. Ooh! What do you think? Now they're 100 cc's and we'll give you a rest. We'll do it on the other side, all right?
Try to uncross your legs for me, my friend. Thank you. Good man.
Turn to the left again, Den. Not Dennis. I'm calling you Dennis. It's Tony. See, I'm thinking about you being on my table, Dennis. This is Tony on my table. You all right? You okay?
Yeah.
This is where my mama told me to go.
You want to fill one up? You want to give it good? Actually, other side will do it.
Yeah. We'll go back here. We're good?
Just under 50.
Good. We'll go back here. We'll go back here, I'm sure. For sure.
It's a good point, Mr. Reed.
Well,
The viewer says, I'd actually prefer to be awake. Being put to sleep is scarier than the actual procedure to me.
absolutely.
There you go.
You want some COVID down your throat? You don't want COVID down your throat, do you? All right. Woo! Put down your arms for a second. Let you rest. Give him a little local. Give him a little A little agua. Agua frio. Agua frio. Good. Okay.
Look at that.
I'm gonna decant this. Here, decant it. So now we gotta shut off the suction.
Yep.
Yeah, I'm gonna actually change my gloves. So let's not make a mistake. Shut off the suction
Suction first.
and undo the yellow.
Yeah.
Good.
Put it up. Yeah.
Undo Mr. Yellow.
Suction's off.
Good.
Still see the S.
Wait, hold on.
There we go.
There you go. Okay, undo the yellow. Good. And bring that down to a, so it's so it's 1500. I got on that side. We'll remember that in our mind, right? Okay. So decamped it. So I got 1500 from the right side. Okay. Write that down. 1500. Bring it all the way down. All the way downtown. Downtown with Leroy Brown. The baddest man in the old downtown. Better than a old King Kong. Better than John. Bring it to 1,000. Yeah, bring it to an even 1,000. That's good enough. Okay, so I need to bring it up to 2,000 and then decant it for 500. You got it?
Did you study math? Look at that math.
I did. I did. They used to call me the Bomar Brain. The Texas Instrument. They used to call me the Slide Ruler, but that's something else.
Do you want to explain it or
I don't wanna explain
Google it?
I don't want to explain it. Okay, what are we doing? So now we got to rehook up everything. Suction there. Okay, so now we're going to bring it up to 1,000. Good. Okay, bring everything over to us a little bit, guys. Cool. All right, I like that. Okay, you all ready? Okay, so we're gonna suck out this side. Lift up, my friend. All right. So sucky on this side. All right.
How long after the operation would you want the patient to stay local?
Minimum 48 hours. You all right? You all right on this side? Good.
Dr. Lebowitz likes to see the patient 24 hours post-op, roughly,
And 48.
and 48.
Yeah. You gotta go by rules, guys, in life. All right.
So if you're flying into town, expect to stay for a couple days.
Right. Okay? When though? Bring it up just a little bit. Yeah. You alright? This stuff here. Alright. Let's get some good. Give me an F. Ooh, give me an A. Give me a T. What that spell? He's laughing.
This is a good one.
Gonna be a good one? Let's do some dripping. Some drippy. You ready?
Whenever you are.
All right. Oh yeah. That's fine. All right, so we're going to go to a liter, 2 liters. Then we're going to decant 500, and then go back up to whatever. We'll figure it out. All I know is I ended at this one. We're starting this one at a liter, and we got a liter and a half of the other one. I'll remember.
Another question. When making the incision under the nipples, how long does that last? I assume scarring, or maybe you can...
Oh, the heel is quick. My incisions are amazing, baby. I got awards for my incisions. I once got a Rolex watch. Yeah, they gave me a Rolex watch once.
Mr. Dreeds, definitely recommend just, if you can keep losing weight, you know, before you get on the table, then it's better for the doctor and it's also better for you.
Oh, yeah.
I lost about 20 pounds.
20 pounds?
That's great.
I poop, I lose 20 pounds.
Nice.
Stop laughing at my jokes. You just egg me on, Clarence. You just egg me on. You know, you don't laugh at my jokes. I won't.
Make your jokes a lot like mine.
What's that, sir? I laughed at you losing 20 pounds. Tell me, I'm so sorry.
Mhm.
That's a start.
I did my homework.
That's a start, losing 20 pounds.
And then, yeah.
So you did your homework, right?
Yeah.
What, with me?
Yeah.
Yeah, of course you did.
Great.
Yeah, who's my competitor? My audience, who's my competitor? You tell. I'm not afraid of my competitors. Ugh.
You haven't got the lead.
I will. I ain't afraid of no ghost.
Does this procedure leave some loose skin?
Nope. I'm going to use Renuvion, powered by J Plasma. Now,
This machine right here.
yep, that machine right there. You right over here?
It tightens the skin.
Tell me.
That was it.
Tell me.
The Renuvion, the removing the gland, that'll be on Instagram. So if you want to, we'll be posting Instagram Live coming up, some stories, and we always post a edited video of the surgery a couple days after.
1350.
Yeah. You all right?
I'm not sure on the question, Dennis. Dennis asked, how long does the incision surgery last for? Not the scar, the hour.
Dennis, I only allow two questions in one day. Dennis, come back tomorrow. No, I'm kidding you. What? Where? How long is it? Well, scars are scars. It's going to always be there. But my incisions are hidden and stealth. Are you right over here? You okay? Okay. That's what I like my patients. Yeah.
Dennis, if you mean actually opening the area, it takes, how long does it take to open on the middle? Minutes.
You all right over here? Good. Oh yeah.
The whole operation. It takes, we usually have
Is this still Dennis? Really?
We're just teasing. We're just teasing.
Dennis, come on now.
Surgery lasts about 4 hours, 4 or 5 hours.
Where you from, Dennis?
Did you say Guyana or is that someone else?
No, someone else. I think so.
You right over here?
Oh, he is from Guyanese. Yeah.
How's the weather in Guyana? Wasn't there like a war there once? There's actually a medical school there. I think there was a war there once. A little mini war. What's that?
I remember that too.
Yeah.
Cloudy right now, but very hot most days.
Wasn't there a war there once, Dennis, in Guyana? We had to send troops there, if I remember, like in the 80s, 70s, 80s, I don't know.
Yeah.
Maybe 90s, yeah?
Where?
In Guyana?
I don't know. Where's Guyana?
It's like one of the Caribbean islands.
No, I don't know. I haven't been to Serbia.
What am I doing? Karate chop.
The karate chop.
Nobody asked about me.
How you doing, Doc?
I'm hanging in there. I'm working. I'm working my bagel and cream cheese off from this morning. Oh yeah.
That's an arm workout right there.
Oh yeah.
Marathon, man. So you got 15 Dr. Lee. I think that's 16. You got 16.
Yeah. I got more work to do. I got more work to do. We're not done. Okay, we're done. You alright over here? You don't know? What's that? Yeah. The more fluid I gotta put in there, the more I gotta suck out of here.
Thanks for working with us, my friend. You're great.
Yeah? Okay. Hang up. Hang another one. We're gonna stop for a second, guys. No, give him a little local. This is the perfect example that we're gonna stop for a minute. He felt a little bit over here, so we're gonna start. Not bad. And you know something?
Was it there or is it? I
Yeah,
feel
we-
a little bit hot.
Yeah, we're gonna do everything. I'm gonna do more.
Yes, somewhere right here.
We're hanging it out a little
We'll
bit.
see.
Just put it down. Give him a little break.
Mr. Dree says, "Hey Doc, when I get my surgery, I'll pay a little extra if you can make sure Dennis is watching on live."
Yeah, okay. You know, actually, pay for his flight. We'll get Dennis over here. We'll get Dennis over here. Dennis, you're gonna be a visiting professor.
We can have two on the table. We'll have, you know.
Yeah. Let me have the that. Be careful about the thing, and then be ready for that. Good. Good. All right. So this is a perfect example of under local. He's not screaming. He said, "Doc, I feel that a little bit," and I kind of see a little pinkness there. So go right there and give him a little bit more. It's easy. Easy peasy. Give them a little bit more. We don't want our patients to suffer. Maybe just a little bit. What's life without suffering, huh? Oops, sorry about that. There we go. See, I want to get way down here. So this is my gynecomastia. Got it.
It's like the honeycomb cereal.
Yeah?
It is. Looks like a honeycomb.
What's your favorite cereal?
Probably.
What's your go-to breakfast cereal? What's your go-to breakfast
Well,
cereal?
I like the chocolate because it's like chocolate milk, but I don't do it anymore. But I kind of either like Count Chocula, or I don't like fruity, like Cocoa Pebbles. Cocoa Pebbles, or
That used to be the best. You put the Cocoa Puffs,
yeah.
you finish the Cocoa Puffs,
And
and
then
it'll be
drink the
chocolate
milk.
milk at the end.
Honestly, I forget what it was.
Oops, sorry.
It was a Kellogg's with almonds. It was kind of like bunches of oats.
Yeah.
Almonds.
Yeah.
That or Kellogg's.
All right, we got 500 more. Okay, there you go. Let it sit for a few minutes. Okay, so we gave him some local. Good. We're gonna let him sit for a few minutes. Not attack him. Not attack him. Put on your arm. Relax. See, at Lebowitz Plastic Surgery, I'm not here to, I'm not only here to make you look and feel great. I'm here to entertain you. Make you laugh, like a clown. Me, the clown. All right, so give it a little few minutes. We're still on live. You doing all right?
Very good.
Good. Oh, I want to start to monetize these videos now.
You know what people say the worst part of this entire procedure is?
What?
Their arms getting numb from their arms going up,
Yeah.
which is something the patients would never have guessed before jumping on the table.
Yeah.
How you doing, my friend? Very good.
Me?
Yeah.
Me and him.
Oh, good about you, Dr.
So we got what? Almost. We got another 400 to decant and then decanting.
400 decant.
Sorry,
and then-
300 and then we decant.
And then 500 to maybe I can turn him on the side. We got some work to do.
Yeah.
Yeah, wash him down. See, now Clarence is keeping me honest here. So we wash him down. Yeah, lift up both arms here for a second, buddy. Good.
How much fat you got out of
That's good fat too.
That's good fat.
all fat?
That's gorgeous fat. Look at that fat.
Little wetness, little chilly.
We're also going to use the curved cannula, right?
Yeah, we got work to do.
How you doing, man?
We got work to do, my
Yeah,
guys,
yeah.
my friends. We got work to do. We've got work.
Taking care of business.
Taking care of business every day. Taking care of business everywhere. Taking care of business.
See,
It's
in
all
the
right.
operating room.
Taking
Know
care
about
of
any of
business.
this, right?
Now, I want to get to 500. The leader.
All right, good man.
Okay. Let's go ahead and
I'll take one of those towels, my good man.
there you go. That's it. Leave it. I got it. You're coming over here. Okay. Yeah, right. All right.
Here's my side.
Should be better. Is it better?
Yes.
Good. We aim to please. All right. So here we are, back in business.
The purple lines are permanent.
Oh, they're permanent.
They're permanent. It's part of the.
Oh yeah. They're absolutely permanent. So, my gloves. Oh yeah, getting the waste from the waste. All right, guys. So who's my competitors? Come on. I'm interested.
Maybe they're not saying anyone because there is none, right?
There's no competitors, but who thinks they're my competitors? Oh yeah. All right, let's get some of this.
Didn't you say you know a doctor from Brazil?
Yeah. Yeah. Who is that?
Dennis could maybe go if it's an issue coming here, right?
I think Brazil is in lockdown, guys. I think Brazil has corona up the wazoo. You all right over here now? Better? All right, we're almost there. Yeah.
25.
All right. Should we STOP soon? Should we stop in the name of love? Should we stop in the name of love?
Maybe you guys on the viewers can help Anthony with that question.
Before you break my heart. Stop. All right. We'll stop. Okay, so drop it like it's hot. Okay, so now let it kind of do its thing. But put down. You know what I want? Change this one. Lift up. Sit up for a second, man. Yeah. Yeah. I put 2 down, so you can just easily take out one. Fold it. Yeah, put 2.
Sit up a little bit.
Yeah, we're almost done.
Don't touch anything.
Yeah, grab it. We can put them around now. Wait, what's that? Okay.
Dennis, the house analogy. Remember the house analogy? It depends.
Dennis.
And
It's a Borat movie, Dennis. Dennis, look at me. Look at me, Dennis. Look at me.
no, Anthony asked the question.
Oh, Anthony.
Anthony.
There's a Borat movie. Borat. It's Adam something Cohen. You know, Borat. Look at Borat, and there's a little segment where he says, "How much?" Just watch that. Watch that little segment, or Google Borat. How much? And you'll see. Okay. Do the thing. Suction off.
I'm decanting it over.
Yep.
Okay.
Good. Do the orange. Yellow. Well, I think I'm colorblind.
Right.